As we celebrate Ocean Ma, women's health plays a really important role. To talk about this, joining us is a very senior expert. We have Poonam Muttreja. She's the Executive Director of Population Foundation of India. Thank you so much for joining us.
Pleasure.
We all know women's health is really important, but somewhere it is really neglected. Why do you think so?
So many of us think women's health is important, but clearly in a patriarchal society, there is every sign and symptom that women's health by families, by even at the political level, unfortunately, is not seen as important. And this has to do with not individuals in the political sphere. It's a reflection of our society where social norms are heavily weighted against women. Women are not only neglected where it comes to health, but their other well-beings, education, literacy rates, if you look at employment, everywhere we see that women are lagging behind. Though whenever women are given capable opportunities, women show capabilities beyond expectations. So I'd like to say that it is to do with the social status of a woman in the country. And, it is the way women are socialized and men are socialized, how we bring up our children. It's we give importance to the boys. If there is a little food in the household, girls and women will eat the last and the least, while men will and the boys they have an advantage, which both they have the privilege from both men as well as women. It is women who practice patriarchy, and women's self-perception of their health and well-being needs to be brought into the sphere of feeling equal, feeling important, and we don't recognize that women, it should be an absolute shame for India that so many women, 24% almost of, or should we say 1/4 of women in India are malnourished, and 54% of women are anemic. And when women are anemic and undernourished, we it's not that society doesn't see undernourished women producing undernourished babies, but again, it's the lack of. I think it's more to do with social issues. I always say behind a woman's every health issue is a samajik issue.
Problem. Yes, yes. I think you put it so well, like you were saying. You were yourself talking of सामाजिक issue जैसे आपने कहा, but the intergenerational cycle की अगर हम बात करें, पूनम जी, how do we break this cycle? क्योंकि अनीमिया है, malnutrition है, ऐसा नहीं है कि women are born with poor health, लेकिन ये जो cycle होता है, आप देखते हैं कि बार-बार बच्चे जैसे born होते हैं, mother malnourished होती है या anemic होती है, तो बच्चा भी obviously underweight या weak होगा. तो हम इस cycle को कैसे तोड़ें?
So this cycle can be broken, and it has been broken in other countries, or it doesn't exist in other countries. So what we need is a healthy girl, a healthy adolescent. We need a healthy mother. We need to invest in their portion. We need to invest in उनके सिर्फ स्वास्थ्य के लिए नहीं, पर उनको कुपोषण दूर करने के लिए, उनके लिए we need to have state subsidy. Honestly, we need more food subsidy for the poorest women, because the poorer you are, the more likely you are to be anemic or undernourished. And intergenerational cycle is very not only cost lives for women. Maternal health gets affected, high maternal mortality, high child mortality is the outcome. And more than that, the children, little infants, are born undernourished. And these undernourished infants also have a heart and are susceptible to many other diseases. So how do we end all this? First of all, we have to recognize it. India has to feel a sense of shame, if I may say so, about the fact that we have so many children being born into this country where they don't have a chance for survival, and if they have a chance for survival, their mental well-being gets affected, their mental health gets affected, so they are never able to cope and with even opportunities of education and jobs given to them. So there are many things we need to do. So let me start with first the nutrition. We need to feed.
Yeah.
We absolutely need to feed our girls and women well. We need to eradicate. We have to make a commitment to eradicate uh, not just anemia but malnutrition amongst our children and our girls. We need better feeding programs than we have today for girls in schools, for all children in school. I don't want wish to discriminate against boys who are undernourished. ये हमें याद रखना चाहिए कि सिर्फ लड़कियां नहीं, बॉयज भी अंडरनरिश्ड हैं. तो हमें दोनों के को अपनी नजर में रखते हुए सबको स्कूल्स में और आंगनवाड़ी प्रोग्राम्स हमें उनको इवैल्यूएट करके कैसे इम्प्रूव करना है. दूसरा, लड़कियों की जब जल्दी शादी होती है तो उनके बच्चे भी जल्दी होते हैं, क्योंकि जो 14 साल 13 साल की उम्र में या 18 साल से नीचे उम्र में जब लड़कियों की शादी होती है, ये देखा जाता है कि उनके पास कॉन्ट्रासेप्टिव एक्सेस नहीं होती टू कॉन्ट्रासेप्टिव, फैमिली प्लानिंग, ना ही उनको नॉलेज होती है, और दूसरा वो काम बहुत करती हैं और दे एक्सपीरियंस वायलेंस ऑल्सो. ऑल दिस अफेक्ट्स देयर मेंटल, फिजिकल एंड इमोशनल वेलबींग. तो इसलिए we have to make sure no girl below the legal age of 18 gets married. And the best way to do that is also to keep them in schools. And the goal of keeping girls in schools isn't just only so that they don't get married. It is for their future and investment. And third, we have to make sure that women have good menstrual hygiene. A lot of the lack of management of menstrual periods of women lead to often excessive bleeding or irregular periods, then infections. It leads to infections which further jeopardize a woman's health. Fourth, I'd like to say that women need access to family planning so that they have children at the right time and fewer children. We need to postpone the first child. We need spacing between two children, because that is what really impacts a woman's well-being, not just health again, and they're all linked, women's mental, physical, emotional well-being. So we have to have health services respond to that. Family planning, I mentioned, 13% of girls in India or women in India who wish to have fewer children and do not wish to have a third child end up having a third and even fourth child.
Yes.
And 30% is very high because either they don't have access to family planning or they don't have the agency and autonomy.
In fact, you've explained that really well, that what we can do to break this cycle, obviously, because that's how, when we're really looking at a healthy population, of course, nutrition, we've been talking about it, it's Poshan Ma. We all know that nutrition is important. All the menstrual hygiene is very important. Early marriage is a big problem and a challenge. But what you said about family planning, and access to contraceptive is critical. In fact, I was reading that female sterilization is the most common method, more than 75%. Whereas male sterilization is easy to do, and barely 1% of people actually do it. So what are your thoughts on that? Do you think we need to change this thinking?
Totally. But it is, I can tell you, it's very difficult. There is a myth and misconception men have that if they get sterilized, their virility will be reduced. And men are so obsessed with their virility. It is unbelievable that therefore that leads or gets converted into only 0.3% men getting vasectomy, while it's 75% for women. And, second thing about men is that they think it is a woman's responsibility. Family planning is woman's responsibility. The burden and privilege. I think women are very privileged to be biologically superior or advantaged to be giving birth to a life. Okay, and so I do not wish to at all insinuate that poor women are very privileged. So let's respect them for the capability and ability and give them all the support. And we need to change the mindset of not just men, but our policy makers, our influencers. You know, I have tried very hard to get men, eminent men, people who are, are influencers in many parts, different industry, to talk about family planning. And do you know, even older men refuse to. They still want to have that image as a stud, which they think comes in the way of them, their image if they talk about family planning. So family planning has to become for men, has to become a societal responsibility. You know, family planning is not is a women's issue. It's equally a men's issue. And I'd like to say that it is a societal issue. Society needs to take this head on and change. You know, once you change social norms and you explain to men, or maybe we should have the kind of, even financial incentives haven't worked, but I do believe that if we do massive campaigns and people in positions of influence can address men, you know, a prime minister, when he addresses people to give up subsidy for cooking gas cylinders, people do listen. A lot of people seem to be listening to the prime minister, our current prime minister. I would love to see people at his level, his leadership, persuade men. And second, I want to make a very sad point here, share some data with you, that, you know, women who experience sterilization, 77% of them have never been through family planning. What do they do then? Most of them end up having abortions as a proxy for family planning, which is so sad. Look, I am for abortion as a right, but not the risk of having endless abortions instead of family planning. And, we need temporary methods. We need to bring in, and government has to stop focusing only on sterilization. You know, there are incentives for sterilization that women get. The families love it. They get a reasonable amount of money, and so do service providers. And even though India does not have a policy which is focused on sterilization, but somehow the mindset. So we need to change mindsets, and we need to give importance to family planning, to change the mindsets, because it will have an impact on all aspects: poverty, literacy, nutrition. It'll impact India, and it'll bring down our expenditure on health in a big way.
So family planning, like you've just said, it is very, very critical. We need to change mindsets. Another thing which you did mention is sometimes a lady or a woman doesn't want to have so many kids, but she, has to have 3 or 4. What are your thoughts on the 2-child norm? Do you think, how would that be for women in the country? Do you see it happening? Should it happen?
You know, India doesn't need a 2-child norm. And let me explain to you why we don't need a 2-child norm. And then I'll explain why it's not going to be good for women. Fertility is declining very fast in India in much of the states. So 20 states already have replacement level fertility, which means that, the numbers will remain constant. We will not have an increase in numbers if we reach replacement level. Second, I want to say that in India, women and families don't wish to have more than 2 children. So women and families don't wish to have more than 2 children. What is the problem? The problem is lack of access to family planning services, and women don't have the authority, autonomy, or agency to decide. So we need to empower women. We need to give them access to temporary methods or any method that suits her at different periods of time, because women's bodily needs keep changing. And given their hormonal changes at different stages, which is adolescence, menopause, in the middle of having babies, the hormonal imbalance, or should we say hormonal changes, determine which family planning method will be most useful. Most countries have many more family planning methods than India. So if we provide temporary methods, women will not have to depend only on sterilization and have endless children in the meantime, or abortions. Second, women don't have autonomy and authority, as I have repeated 3 times, but it is important, so it keeps coming up in my narrative and conversation. So what it will do is, even those women who wish to have 2 children or 1 child, because they are forced to have a 3rd child, especially if they haven't had a son, or because nobody cares about family planning or their health. So is it not fair to women when they are the ones who don't have agency and they don't have access? So a 2-child norm will not work. And also in much of southern part of India, where women have access to family services, better access, and fewer children, why shouldn't we give the same access in UP, Bihar, Rajasthan, Assam, and all these states where fertility rates are high? If women were in school also, they would have fewer children. There is data in India to show that if a girl has studied class 12 and above, or only class 12, she's likely to have not more than 2 children. So why don't we, the best contraceptive is education. And education will also take them forward in their careers, in their economic growth, and the country. We keep saying there's this demographic dividend. This demographic dividend will become a disaster unless we invest in the literacy skills, etc., of our young people. So it's a win-win situation. Absolutely. And other states did not have a 2-child norm and coercive practices. In India, 20 states didn't have that. So why should we have anti-women policies? Women under the 2-child norm will not be able to stand for elections. Women will not get promotions. That's the kind of 2-child norm coercion that, and incentives and disincentives we are talking about in this country, which is not necessary. When there is a productive, constructive path, which is not harmful for women. And finally, Ambika, I want to say that when you enforce a 2-child norm, like they did in China, 1 child and 2 child, they had huge imbalance. They had fewer girls because girls were aborted or feticide, infanticide. And in India, even without having a 2-child norm, we have such poor sex ratios. We have fewer girls, especially in Haryana. The girls are being bought for marriage from Assam. We don't want this situation.
Even further, and in fact, unfortunately, maximum girls, childhood, we talk about that as well. So it's a very, very, very difficult situation. But like you were telling us, education is definitely the key. It'll help space out, women will know that, okay, it's good for their health. It's important for them to space out children, how many children to have. Just a question on, are we talking enough of reproductive health at the right age? Are we really normalizing the conversation? What we should be, talking to children in schools at the right age, giving them that information?
That is, in fact, the most important after education. That is really important, but are we doing it? Not enough. We don't have trained teachers, nor do we understand the importance of sexual and reproductive health. And, it's all about young people's health, young people and their mental health, not just their physical health. It's also about, having safe sex. It is about postponing when young people have safe sex or sex in general. So if
Yes.
you look at countries where they've had sex education, the age of first sex has got postponed, which is important. And no amount of telling young people don't have sex is
Will
going
work.
to change the reality. We know that.
Hmm.
So we are in denial in India, and we have all these myths and misconceptions that if
Hmm.
we give sex education to our children, they will
Yeah.
have they will become promiscuous or have more sex, which is the opposite. In fact, I want to tell you about in Bengal, where one of the first NGOs to
Hmm.
start a sexual and reproductive health education program, the girls noticed that the boys used to stand outside the village and tease them, do eve teasing, and almost bordering to harassment. And after sex ed classes, that stopped. So I was a part of that, and I said, why don't we do an evaluation to see
Hmm.
boys stop teasing girls? Because we have to learn so that we can
Yeah.
do it in other places. Do you know what the boys said? They said, we thought girls are some product to be just teased, or
Yeah.
sexually attracted we were to
Hmm.
them. We had no other perception of girls. But
Understanding. Yeah.
after this sex education, we realized they are equal human beings. And
Hmm.
sex education is not just about sexuality. There's very little in it.
Yes.
Even parents who object. So we must understand it's about gender equality, it's about respecting women. And it's
Hmm.
not just about respecting women of the opposite sex who are your age and who are outsiders, but it also leads to greater respect for your mothers, for your sisters,
Yes.
for their well-being,
Family.
for their, they understand that they need to eat equal amount. So in India, it would be great. It'll be really in the interest of our country, our people, our girls and boys. Even for boys, they are misled. I mean,
Yes.
teasing girls, sexually abusing girls is something that we need to not to do. We
Yeah.
need to educate and make people realize the consequences. And it also has poor consequences, not only because you get caught, but anybody who abuses another person is somebody, it leads to all kinds of distortion in their personalities, which
Yeah.
impact their ability to study, concentrate on anything, whether it's job, studies,
In
or
every
anything.
field. Yeah. I mean, everywhere, in fact. Yeah.
Yeah,
There's
so
no.
I'm very glad you raised this. This is a very important question, and it is
Yeah,
a
because it's all
question.
connected. It's all
Yes,
connected, right? I mean,
you're so
it
right.
starts, you start feeding your, I mean, you explained it so beautifully. From the beginning, we need to take care of the girl child. It's not just, when she's going to become a mother. So it's a very well explained. I mean, it's actually a chain reaction. So thank you for explaining that. Just a last question before we go, as part of the NDTV Doll Banega Swasth India campaign, we're moving on to season 8. And our focus here is to leave no one behind, So you have worked with the vulnerable population for many years now. How can we really achieve this? I mean, it's a huge target, and how do we just manage, like, making sure that we really don't leave anybody behind?
So, if we are serious about leaving no one behind, there is a very easy way, but it's a policy decision, it's a programming decision that has to be taken. And that is to start with the most vulnerable. You know what we always do? We start helping or treating or giving health services to the better off. District hospitals in cities, small, large. When it comes to the most remote populations like the tribals and the Dalits, the who are the poorest, and
Yeah.
some of the minorities, we reach them the last. The
Yeah.
people who have the least are reached the last. So I think we need a paradigm shift.
Hmm.
Let's do a vulnerability assessment and reach the last first.
Right
And if
first.
we do that, I promise you, we will leave no one behind. And we must. It's not rocket science. We just have to have a vulnerability assessment of who is the most vulnerable. And let me tell you, our bureaucracy, our health bureaucracy, our governance has the capability of doing that. but we need to go through this paradigm shift. And again, we need the government to make a political commitment to the most vulnerable, and then no one will get left.
That's indeed really, really encouraging. Thank you so much for giving us your valuable expertise and coming on our show. Thank you so much for joining us.
A pleasure again.